Key findings from the 2019-2020 Gambia Demographic and Health Survey. The 2019-2020 Gambia Demographic and Health Survey, or GDHS, is designed to provide up-to-date estimates of basic demographic and health indicators for the Gambia. The 2019-2020 GDHS is the second DHS survey implemented in the Gambia. The first DHS was conducted in 2013. 6,549 households, 11,865 women, age 15 to 49, and 4,636 men, age 15 to 59, were successfully interviewed in the 2019-2020 GDHS. This represents a response rate of 97% for households, 95% for women, and 87% for men. The 2019-2020 GDHS provides estimates at the national level for urban and rural areas and for each of the 8 local government areas in the Gambia. The survey results show that the Gambia has made progress in demographic and health indicators over time. Fertility in the Gambia has decreased from 5.6 children per woman in 2013 to 4.4 children per woman in 2019 to 2020. This means that women in the Gambia would have, on average, between 4 and 5 children. Nearly 1 in 5 married women, aged 15 to 49, use a method of family planning. 17% use a modern method and 2% use a traditional method. Injectables are the most popular modern method, followed by implants and the pill. More women are using family planning. Modern method use has increased from 8% in 2013 to 17% in 2019-2020. Traditional method use has changed little since 2013. Unmet need for family planning is defined as the proportion of married women who want to delay or stop childbearing but are not using family planning. In the Gambia, 24% of married women have an unmet need for family planning. Unmet need has not changed in the Gambia since the 2013 DHS. The 2019-2020 Gambia DHS asked respondents about the deaths of their sisters to determine the maternal mortality ratio, or MMR. In the Gambia, the maternal mortality ratio for the 7-year period before the survey is estimated at 289 maternal deaths per 100,000 live births. The confidence interval for the 2019-2020 GDHS MMR ranges from 204 to 375 deaths per 100,000 live births. Maternal deaths include deaths to women during pregnancy, delivery, or the 42 days following delivery, excluding deaths due to accidents or acts of violence. Contrary to the current survey, the 2013 GDHS used a definition of maternal mortality that included deaths due to accidents or violence, and therefore maternal mortality estimates from that survey cannot be compared with the 2019-2020 GDHS MMR. The 2019-2020 GDHS also measured childhood mortality. In the Gambia, neonatal, infant and under 5 mortality levels have increased since 2013. Neonatal mortality has increased from 22 deaths per 1,000 births to 29 deaths in 2019-2020, while infant mortality has increased from 34 to 42 deaths during the same period. Under 5 mortality has increased slightly from 54 to 56 deaths. This means that 1 in every 18 children in the Gambia does not survive to their 5th birthday. Antenatal care coverage in the Gambia is improving. 98% of women in the Gambia receive antenatal care from a skilled provider, such as a doctor, nurse, or midwife, an increase from 86% in 2013. The number of antenatal care visits is also important. Nearly 8 in 10 women made 4 or more antenatal care visits, which is essentially unchanged from 2013. Delivering in a health facility decreases risk for both mothers and newborns. Nationwide, more than 8 in 10 births are delivered in a health facility. Health facility deliveries have increased since 2013, when 63% of births were delivered in a health facility, While this is very good news, 15% of births are still delivered at home, putting mothers and babies at risk. In the Gambia, 85% of children aged 12 to 23 months have received all basic vaccinations, 1 dose each of BCG and measles vaccine, and 3 doses each of pentavalent and polio vaccines. Less than 1% of children did not receive any vaccinations. Basic vaccination coverage has increased from 76% in 2013 to the current level. The GDHS measures children's nutritional status by comparing height and weight measurements against an international reference standard. Stunting is an indication of chronic undernutrition. Childhood stunting has decreased in the Gambia from 25% in 2013 to 18% in 2019-2020. During the same time period, the proportion of children underweight has declined from 16% to 12%. Childhood wasting, an indication of acute malnutrition, has decreased considerably from 12% to 5% over that same period. The 2019-2020 GDHS provides insights into violence against women. In the Gambia, nearly 4 in 10 ever-married women aged 15 to 49 have experienced spousal violence, whether physical, sexual, or emotional. Ever-married women's experience of spousal violence has increased from 26% in 2013 to 39% in 2019-2020. The percentage of women who have experienced spousal violence in the past 12 months increased from 12% to 17% over the same period. Overall, 73% of women aged 15 to 49 have been circumcised. Nearly 2/3 of circumcised women reported that they were circumcised when they were younger than age 5. The 2019-2020 GDHS also asked mothers about whether their daughters had been circumcised. Overall, 46% of girls aged 0 to 14 are circumcised. As you can see, the 2019-2020 Gambia Demographic and Health Survey provides a wealth of information about the population and health situation in the Gambia. Results of the survey show where progress has been made as well as areas for improvement. The 2019-2020 GDHS was implemented by the Gambia Bureau of Statistics. Funding for the 2019-2020 GDHS was provided by the United States Agency for International Development, the United Nations Population Fund, the United Nations Children's Fund, the United Nations Development Programme, the World Health Organization, ActionAid International, the Gambia, the Network Against Gender-Based Violence, the National Nutrition Agency, and the Government of the Republic of the Gambia. ICF provided technical assistance through the DHS program, a USAID-funded project providing support and technical assistance in the implementation of population and health surveys in countries worldwide. The content of this report are the sole responsibility of GBoS and ICF and do not necessarily reflect the views of USAID, the United States government, or other donor agencies. For additional information on the results of the 2019-2020 Gambia DHS, please contact the Gambia Bureau of Statistics in the Gambia and the DHS program in the United States.